Hello everyone. Today we are going to have a conversation with Dr. Nanthini Devi, aesthetic and plastic surgeon from Chennai. She is going to share her point of view regarding the field of plastic surgery as well as her academic journey. Thank you, Nanthini, for joining.
Hello, sir. Thank you for inviting me. Okay.
Okay, let's topic directly. How you chose this field and which made you select and where you completed the post graduation?
Like everybody, I was thinking I should do the most promising field. First rank irukavanga, what they take the seat, that field I should take. That was the idea when I finished MBBS. Fortunately, I did not get the seat. So I was working in a private setup as a duty doctor. There I met a plastic surgeon, Dr. Sendil Kumar. I worked with him. I actually liked the field. If somebody asks me why I chose plastic surgery, I'll just say I fell in love with plastic surgery. That's what I would say. So because of that, I chose. I went in knowing what are the pros and cons and why I like the field. And I did my plastic surgery at Elite Mission Hospital, Sushruta Institute of Plastic and Reconstructive Surgery at Trishur. I directly did a 6 year course because I wanted to do plastic surgery only. So it does not matter whether I do MS, MCH or direct DNB. So I chose direct DNB.
Many people take the post graduation based on infatuation. They may not be knowing the full details of the field, like pros and cons, how the life will be, what are the demands, and all other aspects. What is the expectation as reality moment field of plastic surgery in learning as well as in practicing?
My experience is completely different compared to everybody else who joined plastic surgery because many of them take it because they think it is an easy way to get a super specialty after surgery, and it is a cakewalk, and it is an easy field to earn a lot of money. So that is the idea they have, and some of them don't even know the difference between what dermatology is and what plastic surgery is. That is the reality even in the medical field. It is not a cakewalk. Basic bread and butter is trauma and diabetic foot. Basically, you have to be running around 24 hours or take care of smelly, long-standing wounds. That is the bread and butter of plastic surgery. It's not all like treating all the actors, all old rich people. No. You want to earn for survival, you'll be doing trauma and diabetic. So when they take and come in to a center for doing plastic surgery, the biggest centers in India that have plastic surgery running all run because of trauma. So it will be a 24-hour trauma center, high volume. That's where you will be working. It will be taxing and physically, mentally. You will be doing microsurgery. That is technically demanding task. That I would say you have to learn that new. It's not like regular surgery. Expectation is cakewalk, but reality is not cakewalk. It is like any other surgery field. It has its high demanding, long work hours. You will be having sleepless nights during your post graduation.
Hint of how the post graduation will be. Can you brief about what you are doing for those 6 years?
So I worked in a high volume trauma center, lot of hand surgery, vascular surgery, replants, revascularization of limbs, and peripheral nerve surgery. That is the main thing that was going on in that center, along with diabetic foot, and we also had cosmetic surgery. As any other plastic surgery center, we had 24 hours call. In the beginning, I had once or twice in a week, and then when I was the last PG there, so when the seniors were leaving, it became so critical. I even did 3 duties per week, 24 hours duties at a point of time. Trauma, replant, revascularization, sitting under the microscope working, that was the main thing that I did. Along with that, in the daytime, we will be doing elective cases of diabetic foot and breast implants, all kinds of breast surgeries, reduction, mammoplasty, gynecomastia, liposuction, all scar revisions, PRP. We even had a hair transplant running there. So I was fortunate enough to work in a center where everything was done at the same place. I don't have to move around different hospitals, and all the cases had enough volume. So yeah.
So, can you just say a little bit about how the progression will be from first year, second year, third year, fourth year? Really, what is the progression? How the learning ladder will be there?
Okay. Basic things like liposuction, diabetic food, these things are big work, like you do in a larger area. So there you will progress fast. Uh,
Mm-hmm.
you'll be handling bigger instruments, cutting tissues, debriding, those things will be fast. Regarding microsurgery, it has a long learning curve. We used to do microsurgical cases on a daily basis, so we learned fast. Otherwise, if the case volume is less, you have to sit by yourself and practice. Even with so much of case volume, our consultants used to make me sit and do practice microvascular surgery in placental vessels. They used to get it from Obgyn department, keep it in the fridge for me to sit in the evening and practice. Dr. Anto sir, he is the one who trained me in that, and we train mostly in AV fistula. So daily doing that made it faster for us to learn, but it is not easy in all the places. And nerve repairs are different from artery repairs. So, and way you hold the tissue. If you have finished MS and joining MCH plastic surgery, you have to relearn everything. The way you hold your,
Mm-hmm.
the way you hold your forceps, the way you handle the skin, everything is completely different, and everything is fine job. So relearning is a big process that you have to do after doing MS. So that is the thing. And theory wise, you have to concentrate not just on textbook. That will not do the job. It's not specialty, it's super specialty. You have to read the journals, you have to discuss with the seniors, you have to increase your networking. With social media, you can even network with senior surgeons, famous surgeons who even wrote the book. You can network with them, you can talk to them, ask your doubts. So, networking is important.
Okay, what, in your point of view, what are all the desirable and undesirable aspect of the field?
Desirable aspect is it's very vast. It's very vast, and you don't do the same surgery on a daily basis. It intrigues you every point of time. Every day you do something new. You will never get bored. That is the same disadvantage. Your learning never stops. You have to learn more and more and more. And reconstruction flaps are like same flap, but the same size and dimension will not suit the place. Elevation may be the same, but the designing and everything, it's kind of artistic. And sitting under the microscope, seeing those vessels live, operating on them, and making them function back, those things are some things that I really, really enjoyed while doing my plastic surgery residency. Disadvantage is the long working hours. You cannot do anything about it. And in at least during your post graduation, you cannot do anything about it. And handling people and taking care of your physical and mental health, everything goes for a toss. If you are balanced after you finish plastic surgery, you are continuing to do only trauma and taking duties all the time to earn your bread and butter, it will take a tax on your health, physical and mental. So, yes.
Okay, now regarding the learning, what are the best practices that you can say to make most of the study period?
Make most of the period is get the hands on whenever you get, learn before you go for the surgery. That's very, very important. Everybody says, and we don't do it. You are posted with a unit, you have an elective case, at least learn that and go. You have a trauma, you have an emergency, you're going in an hour, just read through the procedure and go, so that when you do it, it reinforces it in your brain. One thing, take extra hours to practice, especially
Mhm.
surgery. Take extra hours to hold the instruments, especially these liposuction, power assisted, baser, everything has different kind of manipulation, how we hold it. So practically these are the things. Learning theory is attend the journal clubs, present in the journal clubs sincerely, read properly, and learn how to write a journal, do your thesis properly. So when you are involved in that and you want to do things properly, you will learn a lot when you come up. And passive learning happens, but you have to tone up the active learning as well. When people finish UG or post graduation go to super specialty, they just go by just passive learning. They don't have time to sit and read and all that. But adding active learning to that helps a lot.
Can you recall any unforgettable moments, positive as well as negative emotions?
Okay, positive unforgettable moment. The first hand replant I assisted, the patient came back for a review. After 6 months, he was in physiotherapy. At that time, I did not see him. After the wounds healed, we sent him to physiotherapy. So he came. I held that hand, that replanted hand, and shook it. I was literally in tears. I was literally in tears seeing him smile. That is the best moment of whole of my 6 years plastic surgery career. I would never forget it. That was in my first year. That was in my first year. And worst moment was I was in my third year, and two of our seniors have already gone finishing the course, so only three of us were there. It was Trishurpuram, so a lot of cases were coming. I was at the hospital for continuous 48 hours. I did not sleep, and I did not eat, nothing. So when I went home, I was trying to sleep. My heart was racing, sympathetic system in total activation. I was in survival mode. I have never experienced that kind of palpitation in my life. At that moment, I thought I'm going to die. And this is how doctors are dying after doing duties. This is the
Uh,
most worst I have ever experienced. So please do.
so I think outside it looks like some very comfortable feel, but I think it is more than demanding. I think.
Yes,
Yeah.
yes.
So, what are in general, what are the other difficulties you faced in the 6 years course in terms of managing your time? Already you mentioned few things, but do you left anything to say on that aspect?
Like time management is not the problem because you're always at the hospital. The management, people handling skills, it's very important. You don't know where you're going to land up, the kind of people you're going to be around. And what I did was a 6 year long course. So, different personalities, different kind of people, different levels of toxicity, everything. So, handling that was difficult, and that we have to learn anyways.
Like
And
for the team as well as the public you are saying, the patients you are saying, or you're saying
no, no,
talking about.
patient handling we will learn. Obviously, we'll learn. I'm handling the co-doctors, the team, and also learning how to talk to the staff and everything. How to handle the staff and what to do and what not to do. Seeing the seniors and learning that is very important. And other thing that I felt really difficult was handling my physical and mental health. I will be completely open about it. The My health started deteriorating. Few of my seniors, when they finished, they were taking antihypertensives. So at the end of it, like when I had 2 years left, I realized I am becoming fat. I am adding up visceral fat. I'm not sleeping properly, and I need to concentrate on that because I did not want to finish the course being a diabetic or a hypertensive. So I started my diet and workouts in the middle of the course, and that was one of the difficult things that I had to handle. But these are basic things which we have to learn, even if we have to survive after coming out.
Let's come to the post practice, post completion. Sorry. So after completion, what are all the different career paths we can choose?
Okay.
Government stuff, freelancing, or going abroad, and other aspects. What are all your ideas on that?
Okay. So, one thing you can join some medical college and work, either government or private. That will be a stable income. You will have some stable income, and from Tamil Nadu government, we do not have restriction for doing a private practice. So that would be a good option. And going abroad, you have a lot of opportunities, but you need to have a proper logbook, proper photographs of the cases that you have done. And to go to Middle East countries and all, you need at least 3 years of experience to show to them and get a job and go. And freelancing. Freelancing is like, openly speaking, like running a petty shop. You have to sit, wait, and work on that. and you have to work on how you treat your patients as well when you start your own clinic or your hospital. If you have some kind of a stable income, you can run for your family and you have some income for your survival, then you can go ahead and start your freelancing or a clinic in the beginning itself. And practicing at multiple hospitals, that is what most plastic surgeons do in bigger cities. So practicing at multiple hospitals, do not take up too many hospitals that you cannot handle. Some of them take up 4 or 5 hospitals and they cannot manage. Once the practice picks up, you will have cases everywhere. So start with 2 or 3, work on your practice, sit and do that, and you will pick it up eventually. Don't overload yourself.
What is your comment on the future scope as well as competition level?
You abroad and bigger cities, cosmopolitan cities, you have major part of cosmetic surgery picking up. It is one of the biggest booming field in plastic surgery. So you want to become a cosmetic surgeon, get a fellowship from somewhere and start off directly with cosmetic surgery. If you are planning to be a cosmetic surgeon, the best place to be is in a city. You cannot sit in a town and build a cosmetic surgery practice. Where you are is very, very important. And going abroad is also the same. They do have trauma cases, etc., but they need us for things like liposuction, breast surgeries, etc. in the Middle East. And if you have to go to some other countries, US, UK, Australia, and all, you have to repeat your residency. That we all of us know. Otherwise, if you are going to sit in your own city, town, or somewhere, basic bread and butter practice will do. Trauma and diabetic food. For that, you have to network properly with physicians there, nephrologists there, other consultants there, and how your rapport is with everybody is very, very important for building a practice, because most cases you get will be a referral case.
Thank you. You gave a lot of information regarding the course. Now, about the institute which you have studied, to select the institute. So,
Okay.
can you give about the institute, like how the management is and how the learning level is load, as well as like how you can manage life there in that area.
The institute which I studied, they have stopped taking DNB courses. They might start taking 3 year courses later on, and they were planning to take fellowship, post MCH fellowships. So it has good volume. 3 big surgeons sat there for 10, 12 years and built the setup there, built the practice there. It's an already built a practice that's running, and it's a major trauma center after Ganga. So you'll get all kinds of cases, like all kinds of trauma, diabetic foods, and they also are doing cosmetic surgery practice. And it is one of the biggest centers in Kerala running brachial plexus palsy, both obstetric brachial plexus palsy and adult brachial plexus palsy. And I myself did my thesis in obstetric brachial plexus. So that's a very good center for learning peripheral nerve surgery as such, not just brachial plexus. Work-wise, it's very difficult to manage. Load is too much, and long work hours, and when you yourself are under too much stress, you cannot support the other person who's working with you. That is what is happening in that environment. Maybe most of the plastic surgery centers, bigger centers who have a course, have such an environment only. So it will be stressful, and managing your food, your sleep, and your time, you have to learn on the go.
How many co-PGs you had?
When I joined, we were 5 in number. Only 1 seat they used to take at per year. So after me, they stopped taking courses since they were planning to actually expand the team by adding more consultants rather than taking in PGs. So that happened. So first 2 years we were 5, and then it came down to 4, and then it came down to 3. When I finished, only I was there. So when you're choosing a place, see all these things before joining your course, and talk to the previous PGs there, other people there, know about the environment, how it is, understand if you can handle it or not. the amount of work, people there, everything. If it is goes too much for you and you have to quit the course half the way, then there's no point in joining such a place. So analyze everything, not just the seat you want and you're getting it somewhere.
Okay, thank you. Nanthini. You have given a lot of information. It's very helpful for many people.
Yes,
Thank you
sir.
so much.
Thank you for the opportunity given to share all this to the juniors who are actually waiting in to take their seats. Thank you, sir.